Mrs. Princey, Associate Professor in Mental Health Nursing. Anxiety is considered as a normal emotional response to any kind of a situation which is very stressful or which is very frightening. Yes, there are individuals who will be able to manage or overcome this anxiety. There are individuals who will not be able to overcome this anxiety. Such individuals can seek the psychiatric, opinion. So when they meet the psychiatrist, they may put the client on certain group of drugs which is known as the anti-anxiety agents. The topic for today is the anti-anxiety drugs. Anti-anxiety drugs are otherwise called as anxiolytic agents. So these drugs are having both the effect of the sedation as well as hypnosis. So we can call this drug as sedative hypnotic group of drugs. As a sedative drug, it is going to cause a calming effect in the client since the client is very much stressed out, and it is going to reduce the anxiety of the client. As an hypnotic agent, it is going to cause drowsiness in the client, and also it's going to induce the sleep in the client. So that is why it is termed as sedative hypnotic group of drugs, right? Moving on to the classification of the anxiolytic agents. So mainly it is classified as the first one, which is the barbiturate group of drugs. These barbiturate group of drugs are further being classified based on the time of the action, right? First one is the long-acting barbiturate group of drugs. The duration of action is more than 8 hours. So example of this drug is a phenobarbital drug. The second one is the intermediate acting drug. The duration of action of these drugs is 5 to 8 hours. Example of the drug is the pentobarbital. The next group of drug is the short acting anxiolytic barbiturate drug, wherein the duration of action is for about 1 to 5 hours. The example is secobarbital. The next group of the barbiturate, we have got the very short acting drug, wherein the duration of action is less than or equal to 1 hour. We have got the example of thiopentone sodium. So that was about the first classification. We have the barbiturate anxiolytics. Moving on to the second category of the anxiolytic agents, one which is non-barbiturate, non-benzodiazepine group of the drugs. In this, we have got this classification. Number one, carbamates, example meprobamate. Next is peprididiones, example glutathione. Next one, we have got the alcohols, example ethanol. The next classification, we have quinazoline derivatives, example methaquinone. The next classification we have is the antihistamine group of drugs, example hydroxyzine and promethazine. The next one is the cyclic ethers, example paraldehyde. The last one is the beta blockers, example is propranolol. Okay, so these are the classification of the drugs which comes under the non-barbiturate, non-benzodiazepine anti-anxiety agents. The third major category of the anti-anxiety agents is the benzodiazepine group of the drugs. So in this also we have got, based on the duration of the action, very short-acting drug, and long-acting drugs. So very short-acting drugs, we have got the examples of midazolam and trizolam. Short-acting drugs, example oxazepam, lorazepam, alprazolam. Then we have got the long-acting drugs, example chlordiazepoxide, diazepam, clonazepam, flurazepam, and netrazepam. So this is about the classification of benzodiazepine group of drugs. Moving on to the indications of anti-anxiety agents. So the major indication is it is used in the anxiety disorders, the various types of the anxiety disorders it can be used. It is used to treat the insomnia, to treat the depression, since there may be chances of having the anxiety. It is used in the panic disorders, social phobias, okay, in the OCD, obsessive compulsive disorder, because of the anxiety PTSD, post-traumatic stress disorder, bipolar 1 disorders, it can be used. Other disorders like alcohol withdrawal and substance-induced disorders. So in these disorders also there may be chances of the anxiety, right? So any disorders which is coupled with the anxiety conditions, will be administering the anti-anxietal agents to calm down the patients. It is also used in nightmares, in conditions of enuresis, and also somnambulism, right? So this is about the indications of the anti-anxietal agents. Moving on to the mechanism of action. So while the drug is administered, how the action will take place. When the benzodiazepine group of drugs are administered, it will bind with the benzodiazepine receptor first to form the GABA complex. This GABA complex will facilitate the release of the GABA, which is a neurotransmitter, which will lead to certain effects like muscle relaxation, anticonvulsant action, as well as anti-anxietal action. So the mainly the problem here is there is a deficiency of the neurotransmitter GABA. So to release the GABA into the synapse, okay, so that the action will take place of the muscle relaxation, anti-anxiety action, as well as anticonvulsant action. So this is the mechanism of action of the benzodiazepine group of the anti-anxietal drugs. Moving on to the side effects of this drug. So we have got the nausea, vomiting, weakness, vertigo, blurred vision, sedation, diarrhea, impotence, retrograde amnesia can happen, and also dry mouth. So that is the side effects of the anti-anxietal agents. Moving on to the nurse's responsibility when the client is on the anti-anxietal drugs. See to it that the drug is administered with the food to avoid the gastric irritation leading to nausea, vomiting, and diarrhea. So you can administer the drug with the food. Instruct the client to take the medication as they're directed. Educate the client to have a drug compliance, to follow the medication as per the schedule. Explain about the possible adverse effects and how to manage those adverse effects and to report if not able to control. Advise the client to avoid the alcohol containing foods and alcohol beverages, and also the CNS depressants. If the anti-anxiety drug is available in the injection form, see to it that you give a deep IM, and if it is indicated to give in IV, you see to it that a drug is administered in a slow manner. A slow IV injection can be given. This is about the nurse's responsibility of the anti-anxietal agents. So the overall indications that you have to know, and what is the effect that it's going to cause, when the patient is on these anti-anxietal agents. So monitor the adverse effects and manage it, and especially educate them to follow the schedule and come for a follow-up visit, so that the dose of the drug can be managed. Hope you all have understood the topic.